Very, very good morning, everybody. I hope you can all hear me and see me okay. My name is Sean McLaughlin, and I'm going to be your virtual host for today's conference, which is, of course, the EVO Virtual Conference. We're going to be looking at the intelligent patient portal, and we're going to be sharing a truly remarkable solution with you all today. So just before we get going with today's content, I'm going to run through some virtual housekeeping to make sure you can all use the platform correctly, and you can all ask questions and share insights throughout the conference today. So please focus your attention on the screen. You've got some audio connectivity FAQs on the left, so if anybody needs to check their sound, please go ahead and do so using the box provided on the left. On the right hand side of your screen, it's going to be one of the most important pieces of your interface. So if you can all follow the directions on the right hand side box, open and expand your Q&A tab, fit it into your homepage somewhere for me, and if you can drop me a quick message in there just to say good morning, just to let me know you can all use it okay, that'll be absolutely great. We've got two Q&A sessions taking place across the day today, so we're going to give you all the opportunity to ask a load of questions and get under the hood of this amazing solution we're going to be sharing today. So just a final call, everybody, please do open and expand your questions tab and drop me a quick message in there like Mark and Marilyn have done already. That'll be absolutely great. Thank you, Sam, thank you, Peter, and thank you everybody else who's messaging through. So next slide, please, team. We're going to be running some polls across today's event, so please do listen and look out for the polls as they hit the screen. I will prompt you virtually, to get involved in them as and when they do arrive. We're going to run a test poll in a second just to make sure you can all use it okay. As mentioned, it's just a test just to make sure you can use it okay. So please do get involved in the test poll on your screen right now, which is quite simply, have you heard of EVO before? Please choose one and then press submit, and we'll give you guys maybe 5 seconds on that one now, just as a quick test to make sure we can use it. And we will share the answers as well, because it's nice to kind of get a bit of an insight into how many of you have heard about the organisation before. So we can share those results. Not sure if we can. There we go. 23% no, yes, and 61% no. Looking forward to hearing more. You're in the right place for that. So next slide, please, team. That's absolutely brilliant. So we've got a handouts PDF as well in your control panel. You'll see the word handouts. Drop that down, expand it open, and that is a PDF brochure with further information. I'm just going to give you a quick whistle-stop tour of what's going to be included in today's webinar, and then we're going to get cracking. So the purpose of today's webinar is to reveal EVO's intelligent patient portal. As we know, patient portals are not new, but we're here to discuss a very new and very cutting-edge approach to patient portals. We'll be discussing and showcasing a second-generation portal which encompasses AI and conversational dialogue to the forefront. The solution seeks to redefine patient engagement. Thanks to its AI and machine learning capabilities, the product has context awareness, allowing it to understand patients and reply with accuracy and empathy. Really, really cool stuff. We're going to launch with Paul Boland, who's EVO's healthcare director, who's going to tell us more about the portal. Then we're going to move into a presentation from Kerry Morgan from E18 Innovation, who will explain the context of the new technology from an ICB perspective. Yeah. Then, very excitingly, we're going to be running into a live demonstration of the portal by John DeJoro, and we're going to be looking at the portal with a live demonstration, followed by a Q&A afterwards as well. And then we're going to be, finally, we're going to be inviting Ron Burdis, who's business consultant for Access, who's a market-leading EPR provider. And Ron is going to touch base on why this portal is their preferred solution. And then we're going to be closing with a final Q&A. So plenty of time to ask questions across the session today. We're just going to run a quick poll now for everybody, I believe, and then we're going to get cracking. So poll one, everybody. What are the main challenges you currently face or associate with patient engagement solutions? On your screen right now, if you can please answer one of the provided answers and press submit, that would be absolutely perfect. Give you guys 5 more seconds on that one. Absolutely brilliant. I think we'll get those answers shared now, so Paul and the team can have a little look. That'll be great. Integration of clinical and measures, yeah, not a huge surprise there for myself. Anyway, absolutely brilliant stuff, guys. So welcome to today's conference. I'm going to welcome Paul Boland to the plenary, and we're going to get cracking. Hi, Paul. Can you hear me okay?
Yes, I can. Good morning.
Good morning.
Okay. Can you see and hear me okay?
I can see you and hear you perfectly, Paul. I'll just wait here a second while we get the slides loaded in, and then I will leave you to it.
Okay, great. And you can see my slide, I presume?
We're just waiting for those to get loaded up, Paul. If you can, that'd be great. Absolutely perfect, Paul. There we go.
Lovely. Thanks, Sean. That's great. Well, good morning, everyone. You're all very welcome to our webinar. My name is Paul Boland. I'm Healthcare Director here at EBO. And so, as Sean says, this morning we're really excited to be launching the EBO Intelligent Patient Portal and explaining to you how conversational AI enables patients to take an active role in their healthcare journey, helping them to feel seen, heard, most importantly, valued and informed. So, first of all, who are EBO? So EBO are specialists in automation and patient engagement. So we help healthcare providers to automate patient-facing processes end to end. And by automating those processes, we release efficiency, we increase workforce capacity, and we reduce operational costs. And we use automated conversation to give the patient a better experience when communicating with the NHS and other healthcare providers. And in this context, our use of artificial intelligence helps to create a rich, personalized experience for the patient and lowers the bar for digital inclusion. And here on screen now are just some of the examples of patient engagements that we're already automating with NHS trusts. So for example, in Somerset, we're managing over 1,000 outpatients bookings conversations every month, 40% of which are handled out of hours. At Shropshire Community Trust, we're automating patient engagement for school age immunisations and vaccinations. And we've achieved adoption rates of, would you believe, 100% and 95% positive feedback on those projects. At Betsy Cadwallader Health Board in Wales, we're automating the process of patient validation of waiting lists in both English and Welsh language, and we're saving an estimated £137,000 per validation cycle, according to the Health Board's own calculations. And indeed, we're accredited for the work that we do in healthcare, and we've got the necessary credentials in terms of clinical safety, data protection, and information governance that you'd expect we would require to be able to work with these esteemed NHS trusts. And I suppose we've built up a reasonable amount of experience in the company now in delivering patient engagement solutions and successfully applying automation and AI to a whole range of use cases. And I guess what we've learned is this. We've learned that engagement is not about form filling. It's about having meaningful conversations with empathy. We've also learned that engagement's not simple. It's a collaborative process with key measurable outcomes. And we know at this stage that it's not automatic. It can't be assumed. It requires adoption, campaigning, and trust building over time. And we know that engagement is not about installing technology. It's about enabling methods of communication that work for the patient. And as citizens, we want to be able to manage each aspect of our lives in a way that fits around our busy schedules. And this means having access to effective digital channels that just work. We expect the experience to be simple, convenient, and straightforward. After all, that's how the modern world works. So when we're communicating with the school via an app, or we're submitting a meter reading for the electric, there's a simple way of doing that on our mobile these days. And patient portals are not a new concept. I mean, Patient Knows Best have been around for maybe 15 years at this stage. And the reality is the technology's moved on massively during that period. So Whereas once it was enough simply to have a digital channel, we now need to take advantage of the latest technology to make that experience much more engaging. Why? Because we need to go further, faster. Traditional portals aren't cutting the mustard. I regularly speak to NHS staff who tell me that uptake of their portals have plateaued at 15 to 20% of their patient populations. Why is this? And after maybe 8 to 10 years of live operation, how can we now supercharge that again to try and reach the other 80%? 32% of visitors to traditional patient portals leave after viewing just one page, the home page. So it's unlikely that they're going away happy with their objective fulfilled. Customers across industry sectors speak about login and password fatigue, not being able to see the wood from the trees when they visit websites for all the information that are on them. And that's certainly true of many NHS websites. So we can and must do better, and patients expect more from the digital experience now. So today we're delighted to launch the first patient portal on the market with built-in artificial intelligence, and that's why we're calling it the Intelligent Patient Portal. This is a portal that's designed with accessibility and usability at its core. It's a portal that's designed for a new patient-centered health service where patients have much more choice and control over their own healthcare. It's a portal that combines all the usual features of a traditional portal and then the very latest in conversational AI. So we believe this is a step change in patient portal technology, and we think it gives you the opportunity to really supercharge your digital patient communications. And I'd ask you this, what's the most natural thing in the world when communicating effectively with another person? It's to have a conversation, whether that be in person or on the phone. Most people's preference is always to have a chat. We know we need to transform healthcare, we need to digitize, but in the rush to digitize healthcare, I think we've probably lost the human touch a little bit. And I'll ask you this, would you rather fill out a form or have a conversation? And I think 9 times out of 10, people would rather have a conversation. So what we're trying to do with the launch of the Intelligent Patient Portal is we're trying to put the human touch back into patient engagement. And we're doing that by enabling two-way interactive conversations that happen directly in the portal. Crucially, this gives you as a healthcare provider complete control over the conversation flow, even when your staff aren't available. So from managing simple to complex self-assessments, consent and questionnaires to complete appointment management, including waiting list validation, the Intelligent Patient Portal will reduce surging call volumes, extensive waiting lists, patient no-shows, and increase staff capacity. And this fusion of interactive virtual assistant with traditional portal functionality is the digital front door to the future of healthcare. But it's not about starting over. It's not about throwing the baby out with the bathwater. It's about taking everything we've learned so far about patient portals and then adding in the latest technology. So it still ticks all the boxes. So we still deliver NHS app integration. We still meet all the specification requirements from NHSE for a patient portal. But then what we do is we enhance the patient experience, enabling you to connect deeply and personally with patients. And this includes human-like conversations. So this is a key usability feature in the portal that empowers patients to take an active role. And we think this is sure to result in improved accessibility and increased adoption of digital channels. And that's why we're calling it a second generation portal, because it builds on what went before to ensure that your patient portal is fit for the future. Okay, and this is a portal that speaks your patient's language. we know that language difficulties are one of the main blockers to better digital inclusion. And that, for example, it's one of the reasons for high DNA rates, particularly in places like London. And the reason is some patients either don't understand or they don't engage with communications in English. But imagine if patients could communicate with you on any digital channel in a language of their choosing. Do you think that might help engage and empower patients who speak a different language? So thanks to its unique natural language processing and language recognition, the EBO portal replaces tedious form filling with two-way natural communication in any language. So from English to Portuguese to Arabic, patients can interact with the portal in a language of their choosing on any channel at a time that suits them. And by the way, this isn't done using some inadequate solution like Google Translate. In EBO, we do this properly using native speakers, proper dialogue design, with the appropriate language data models being trained for the specific use cases in question. It's also about restoring empathy. So where other solutions maybe remove that human touch from digitalized pathways, EBO's solution restores empathy. And we do this again through language recognition, through conversation. So we have the ability to understand the context and the content of the patient's query. And this helps us to manage the conversation flow and respond appropriately to what the patient is saying. So really, traditional patient portals are essentially dumb forms of communication. They lack the intelligence to understand the nuance of what's being asked of them by the patient. The difference with EBO's solution is that it's intelligent. It's able to converse with patients intelligently, responding appropriately to what they say, and displaying empathy, which is a crucial factor really in healthcare provision, and something that I think we've completely lost in the move to digital pathways. So we can understand patients' intent, their emotions, their tone, and we can provide accurate responses accordingly. And just like speaking to a real person, EBO's context-specific awareness and natural language processing abilities means we can keep track of patients' data and personalize conversations. So for example, patients can return to the intelligent patient portal and simply pick up a conversation where they left it at their last visit, rather than having to start all over again. Patients can hop from one conversation about maybe their appointment to another about their diagnostic results without needing to start all over again. So that's what we mean by being user-friendly. And of course, we want to be able to provide you with rich data and rich insights to patient behavior and patient preferences. And our sentiment analysis provides management with a new level of business intelligence and insights into patient behavior. So we can help tell you how patients feel in terms of self-assessments and how they think in terms of proms and prems, for example. But then what we do is we analyze the language that's used and we analyze the conversations. And we provide this to you in a suite of visual dashboards to help you keep track of all the detail around your patient communications. And administrators can control everything from an easy-to-use admin portal that provides clear views of patient lists, enables configuration settings, and as I say, provides dashboard with key metrics. So these dashboards are real-time, and we provide you with a full suite of KPIs that enable you to keep track of exactly where you're at with patient interactions via the intelligent patient portal. And I think the next frontier is voice. You know, we're already seeing voice being used in our day-to-day lives. We're using speech to text on WhatsApp. We're maybe asking Siri or Amazon Alexa for directions or even how to switch on the TV. And the reality is that this technology is lowering the bar for digital literacy. And yes, it takes a little bit of getting used to, and not everybody is using it, not yet. But you'd be challenged to say it's a passing fad, you know, and I think most people would agree with me that that technology is likely to grow in uptake in our day-to-day lives in the years to come. And really what this is about bringing healthcare up to speed as well, because patients expect it and they want it, you know. And wouldn't it be wonderful if patients could just say what they want and the built-in virtual assistant on the portal surfaces the relevant information to them? No need to figure it out by pressing loads of buttons or navigating around and getting lost in endless web pages. You simply say what you want and the virtual assistant serves up the answer. Can you imagine the benefits in terms of making healthcare accessible? One of the things that we're really focused on in EVO is adoption. Okay, I spoke about how a lot of portals plateau at that 15 or 20% uptake. So one of the things that we do is we work really hard to keep driving adoption over time. And the intelligent patient portal's machine learning and language recognition capabilities give it the ability to continuously improve and continuously learn. Okay, so we're able to apply self-learning techniques to train and keep its language library up to date so that it learns as it goes. This means we can adapt, understand, and handle a wider range of complex tasks and continuously increase the answers we can provide to patients so that they get more and more value from this as a digital channel. But it's only partly about the technology, it's also partly about how we implement that technology successfully. And so we have a team of consultants within the company, and what we do is we have a laser focus on benefits realization and driving adoption. So we do things like work with your communications teams, we look at multi-channel communications, we look at different techniques to drive uptake and adoption over time. And we offer that all as part of our managed service on an ongoing basis. So this is not about giving you a piece of technology and saying you're on your own. It's about us working in partnership with you to drive out the results and drive up adoption on an ongoing basis. So I suppose really what we're talking about is a transformative partnership. With the Intelligent Patient Portal, you're not just adopting a solution. You know, what we're trying to do is we're trying to fundamentally bring about a step change in how we engage with patients. And we want to do that by putting the human touch back into healthcare, okay? So it's really about transforming how we communicate with patients so that we have a better healthcare system for everyone, you and me included. So I'm happy to take any questions at this point before we go on to the next speaker.
Hi, Paul. Did you say you wanted to answer a quick question now?
I'm happy to. If there are any.
Just have a little quick one here, which we'll get asked. So, what work have you done at Books, please? Have you done any at all, Paul?
At Buckinghamshire?
Yeah.
Yes, indeed. Yeah. So we have a good partnership with Buckinghamshire, and Buckinghamshire are they're an access customer, and so yeah, I mean we've been speaking with them and building up a bit of a strategy around how we can apply this technology and the Rio virtual assistant, which is a product that we supply through the Access Group, to basically bring conversational AI into the fold in their patient communication. So we've been talking to them about a couple of different things, to be honest.
Perfect. Right, well, what we'll do then, Paul, we'll crack on now into John's presentation, and we'll do some Q&A after the demo. Is that all right?
Sounds good.
Absolutely perfect. Thank you, Paul. Really appreciate that. Right, everybody, appreciate all the questions coming in thick and fast. As mentioned, we will get a chance to ask them in 2 Q&A sessions across the day. If for whatever reason we don't get a chance to ask the question, the good thing is about these virtual conferences is we will send the question afterwards to the speaker and they will open up the dialogue with you directly, so no question will go unanswered. So, John, how are you? You okay?
Doing very well, Sean. Yourself?
Absolutely brilliant. Yeah, not too bad at all. Just a normal rainy day here in Manchester. But just as a quick introduction, John is the Chief Operations Officer at EVO, and is going to be providing us with a whistle-stop tour of this next generation intelligent patient portal. So over to you, John. I can hear you, I can see you, and I've got your slides in full screen mode, so we are ready to rock.
Good time. Okay. Thank you very much, Sean. Okay, guys, so I've just got a few slides and then I'll break into a bit of a demonstration. When we were designing this move, basically previously, and this one I'm going to show in these slides, we have already deployed a number of these use cases across a number of trusts. And we were using the usual, what used to be the chatbot, and moved to a virtual agent widget on a website. So what we want to do is move to a portal, to a central portal that would take over the desktop, take over the mobile phone, still provide the advantages of the portal, but also introduce the idea of conversational AI to the portal. So I'll actually break down the screen a little bit further on, but the idea is to maintain the idea of signposting, providing links to the various use cases that are available. So if a patient comes in and they just want that approach, they could use it, or else they could actually start a conversation, or looking towards speech as well. Now, the key element, and it's something I'll mention several times during this, is that this is all a configurable framework. So the screen that you're showing is just what we've ended up with so far for the presentation. But how you show the links, what prevalence they have, and what you actually state on the portal, it'll be something that we can work with the trust in order to design. Or they could just take the default screen as it is. With regards to the portal itself, once you break into a conversation, we have used the strength and the idea of the portal of displaying information, and those kind of dynamic screens are shown on the right. And then on the left, the conversation will be had. It's all about making sure we use the best possible real estate that we can. We are also looking to make sure that signposting and access to links would also be part of the design. This is a display that is focusing a little bit more on the conversation design and the information that's being shown. I'll take you through that a little bit later. The key element that we wanted to mention in these couple of slides first was when we analyzed the requirements of the NHSE, really the main pillars were already being covered by a lot of the work that we were doing with trusts. So it was all around making sure that we gathered, used the use cases, used the knowledge that we have, but then started to introduce it into the form of a portal that could actually be modified to meet the requirements of the specific trust. And that is what we've ended up, and that's what we're going to be showing a little bit today. So things like appointment management, we've got it deployed in a number of trusts. Locally provided guidance, another requirement from NHSE, is something that we're engaged with trust on as well. We're firing off notifications. We've got both notifications, which are basically triggers being received from the ERP, such as Rio from the Access Group. And apart from the notifications, those go immediately. So for example, you look to book an appointment, comes into the virtual agent, and that is reached out to the patient via an SMS. We've also got the idea of reminders built in, whereby we want to reduce DNAs by reminding the patients that they have appointments coming up. Questionnaires are all built in as well. That's PROMs and PREMs. We're doing a number of assessments as well. And another key area which seems to be developing at pace is in and around viewing patient letters. Now, we've actually bundled this together with the idea of patient correspondence. We can actually show any of the correspondence which is stored that we are given access to via the ERP, and then we serve them up into the document. I'll be showing that in the demo in a few seconds. Another requirement, we were very happy to see this as part of the NHSE requirements. We think it's critical, and that's providing patients with a single point of contact. That is actually a strength of the approach that we're taking, whereby patients are actually guided, and adoption can then be strong towards a single portal. And then at that point, rather than them having to dig through menu screens, they can just ask a question. So whatever questions on their mind, we can build those questions into the virtual agent. And that is something that we've developed over a number of times with a number of the trusts that we're working with. Just a couple of screens on some idea of what the adoption and the usage is like, and the reaction to using virtual agents. With regard, this one is showing school vaccinations. These are results that came out of Shropshire. As part of the program, they still provided, the trust also provided the option to still use paper. Actually, we got 100% of the patients actually, sorry, in this case, it wasn't patients, it was the clients actually using the virtual agent rather than going back to paper. and we've got extremely strong results back from patient experience feedback scores. So 97%, only 3% disliked, and that is something that is constantly analyzed as part of the data set that we provide as well. So we've got very strong adoption when it came to vaccinations, and that obviously results in extremely good results. With regards to the appointment management, we've seen a constantly growing adoption rate. The big thing of the conversation is if the virtual agent doesn't understand, then it's not a method of working which is going to work. So that's all about the AI model, and I will show and explain and break it down a little bit in a couple of seconds. But at Somerset, for example, we have a 99% recognition rate, and that means that the statements and the requests made by patients are correctly understood by the virtual agent, and the appropriate information is then fed back. So again, some very strong results when we're talking about appointment management here at Somerset. Okay, so I'm going to break into the demonstration. Second. Okay, so I have two demonstrations to show. The first demonstration is in and around waiting list validation. Now, this is a flow that is generally used rather than from a desktop. It would happen on a mobile device. So I'm going to go through this flow here, and this is all about finding out whether patients still need their appointments after a significant amount of time, maybe on a waiting list. So that information is pulled into the virtual agent, and the virtual agent then begins communicating with the patients. They will receive an SMS with a link, as it can be seen here. Once that link is selected, it will take them into the virtual agent directly, and the virtual agent will then take over the entire screen. Now, here it's important to know we're taking the idea that we're working with NHS login, and we're going to be adopting that in the coming weeks. We're actually working with NHSE on this at the moment. So that whereby the device may well be recognized, and there might well be a login process as well before it, but that is based on that verification process with the patient itself. So the patient may provide details or just use the NHS login. So over here, Michael Taylor has been identified. We'll show something simple like an NHS number if that is appropriate. This is configurable. And we're showing two tabs. There's a tab with the conversation, and we could easily have another tab which shows any appointments that that particular patient has. So we've come in here and it's asked a simple question. It seems like you're on the waiting list. Do you still need the appointment? You could say yes at that stage. Okay, it says thank you for confirming. This information then gets trapped, and at this point it can provide any information that is required by the trust to send out to the patient, guiding them to the next steps, etc. Now, the beauty of using the virtual agent here is either at this point we could trigger a conversation that the trust would like the patient to have with the virtual agent, or we could be actually ready to actually accept any further questions that could be asked by the patient. And as long as it is something that the virtual agent is capable of understanding, then it would trigger the appropriate dialogue. And we've built a number of these, and this is something that we've used very successfully. So in this case, it's look, I'm struggling to walk and work, and I'd like to be seen as soon as possible. And in this case, the option from the trust is, look, would you like someone from the service to actually reach out to you and discuss? And that would mean that a portion of patients would be approached in that way. This is something that could be constructed based on the discussion with the trust, and these workflows would be defined via a workshopping process. But this is just an example of how it could be approached. Patient safety is obviously critical. This is not an emergency service, but if it is something that could be urgently looked at, we could provide them with the appropriate advice. And that would be the process using a mobile phone. As you can see, the patient portal would be totally responsive depending on the device that it is working on. So that's the first one. Let me move over to the second one. Now, so over here, I'm just going to show a kind of conversation that a patient could have with the patient portal. Over here, as I mentioned before, this is configurable by the trust, and we can actually structure this as needed. Signposting is very important. So some patients will not want to actually start a conversation, as it suggests here. Some patients will just want to click view appointments and see the information being displayed in front of them. That is absolutely part of the idea here. So we are merging the best elements of patient portals. It's a simple form of menu structure with this idea that you can actually just have a conversation with the virtual agent as well, should you want something more specific. I'll just ask a question here. Now over here, there's a couple of elements that we're going to show. So can I see my appointment letters for last May, please, related to back pain? That is something that the AI can actually break down. And this is something we would build in time yourselves. So you're understanding that it's appointment letters. We've got a date in there, last May, and it is related to back pain. So I shall send that in. Over here, you've got signposting immediately with suggestions of what the discussion and the identification of the patient, if they are appropriately identified on the device. Now here, exactly, now we're showing exactly what the kind of thing we can expect from artificial intelligence as we begin to develop it. So it has related back pain to the MSK service, and obviously it's identified appointment letters and the date as well, and it's provided them here. We would pull them through to the virtual agent, always displaying information on this right-hand side, on this panel, and keeping the conversation going on the left. You'll be able to click, download the information, if that is what the patient would like to do. Moving on, asking a different question. Can I see my correspondence for other appointments? That's a little vaguer. The virtual agent will probably say, sure, your appointment letters for all your appointments are displayed on the right. And then it will be able to display them in the form of carousel, where they could all be viewed, etc. So this is the kind of functionality that can all be built in. The kind of conversation you're seeing would all be approved by the trust, and we would build those capabilities in as we go. Moving on to a different element, can I see my blood test results? Absolutely. We would understand that it is a blood test, and we will pull them through in the appropriate manner and then display them on the right-hand side. Okay. Going back to appointment management, you say, when is my next appointment? It would actually just pull that through. There's nothing really else to say. So that'll be a decision we make as well in the flow. Is it worth showing it in the conversation flow, or is it worth pulling it out and showing it as a panel? Over here, we said, is it possible to get an appointment sooner? I'm still in pain. This kind of, if you can see on the right-hand side, it's switched back to suggestions. So that's your menu system working as well there. Now, over here, for the purpose of the demonstration, I know many trusts won't actually respond like this, but it's just to give an example. We said, look, here are next available appointments. This is showing that the ability to reschedule appointments should be available, to viewing appointments, and we shouldn't underestimate the value of just viewing appointments. We've got very heavy take-up of that. The simple fact that the patient is able to go in to a simple screen, pull their appointments through and see them, gives them great confidence. And it was a huge benefit that we were surprised at the take-up it got. We thought it was an avenue to something else, but really it was a means to its ends itself. So over here, we're rescheduling an appointment. We would give them the appropriate confirm. We would press that, and then it would be displayed on the right-hand side, as you can see. Now, this is something else that we would look to build with the trust. If there is information from the service that is uploaded into the ERP and the EPR, and it could be pulled through, we would actually display it in here as well, in this way. So in here, they're showing a self-video guide. So links to any other websites, to information, or actually just pulling through videos, etc. Those are all elements that will be handled by the patient portal. Okay, so over here, Michael has thanked the virtual agent. Is there anything else we can help you with? Michael has obviously enjoyed the process, so he's asked that the communication would go via the portal instead of via letter. This is just a simple use case that we're actually deploying in a couple of places whereby we're actually pulling through the demographics. So what are the settings of that patient? What is the information? And we could look to update it should that be something that the patient requests. And that is the demonstration. I'll be happy to take any questions. If that is part of the schedule, I don't want to upset Nikki and Sean.
Hi, John. Questions is indeed part of the schedule. So yeah, we've had quite a lot. So I will I'll run through the shorter questions and then we'll leave some of the longer questions and more perspective till a bit later on. So let's get going. What if a patient doesn't have a smartphone? Can they use this on a desktop, John?
Absolutely. So this is this is basically using the browser. So anything that works on a smartphone or a desktop, it will just reconfigure automatically. So the idea is of a responsive design. We've actually created designs which are different depending on the device it ends up on.
Absolutely brilliant. Thank you very much. And do you have an API with Epic already in place, John?
API with Epic, that is something we are working on. We're working with all the major suppliers. Now, the way this often tends to end up working is once we come to discuss with the trust, we then engage and develop APIs as well. So this is kind of like that process.
Yeah, absolutely brilliant. Makes sense. Do you envisage patients contributing symptoms prior to the clinical appointments?
So we are working on a number of assessments where it is reached out directly via the trust. So they would request information in advance of the appointment. There is the potential to do that within the virtual agent, whereby they come in and say, look, I have this appointment. I'm feeling like this or like that, or I have these particular symptoms. We could trap that information. Now the system in the back end has a whole system of alerting and notifications that would go into the trust. So that would be context sensitive. So we would understand the service by the appointment, pull that information in, and then direct it as appropriate within the trust. And that is part of the flow that we actually devise. As far as the back end processes goes, one of the key elements is to try and make sure that we merge with the trust's current processes as much as possible. This should be another source of information that patients have access to 24/7, put my teeth back in, and pull that information through and actually just use the channels which the trust already have established as far as the process internally goes.
Brilliant, thank you, John. Great question here. So what are the inbuilt safeguards for confidentiality?
Just say that last word again, Sean.
Confidentiality. So have you got any kind of, inbuilt safeguards for that?
Yes, no, so this is a big part. Everything you're seeing is secured end to end, obviously using the latest technologies. This is all hosted in Microsoft Azure, and all data is kept within the UK. It's an ongoing thing. It's the two big elements that we're constantly working on: clinical safety, working on clinical safety elements all the time, and patient confidentiality is obviously key as well. So everything around data protection is in place. When it comes to patient information, it's all heightened. So absolutely, and we'll be happy to go through those elements as needed. Absolutely.
Absolutely brilliant. Got all the right answers there, John. So two more quick questions and then we'll move forward. So do you have any maternity examples currently live, John?
Maternity, I do not believe so, but we would love to work in that area, absolutely. We don't have any examples at the moment.
Yeah, just a bit of a call to action for the delegate that asked that question. Just reach out to the guys. As mentioned, absolutely. It'd be great for them to kind of follow up and get a little bit of understanding of your...
Sorry, Sean, if I just open 30 seconds on that, the use case itself is defined by how it is used is defined by the service. We consider that's an extremely flexible program in that degree and solution in that degree. So it is very much about, we have a stage which is definition, and we would go through that with the service and understand what they want to achieve. And that is the objective. It's always about the benefit.
Absolutely brilliant. And it probably leads on quite nicely to the next question. I feel like I already know the answer, but do you have an offering for primary care, John?
Do we operate in primary care? Yes, we do operate in primary care.
Absolutely brilliant. We've got a quick one in again, so I'll ask this one. Can someone access it while they are outside of the UK?
Oh, that's a really good question. Yes, is the answer. They could, absolutely. It would be an internet connection. The other question is, would you want to restrict it? I don't think there's any point in restricting it from a patient point of view. What we'd have to do is make sure that the data is held within the UK.
Yeah, makes a lot of sense. Well, John, the questions are coming in thick and fast, but we'll leave it there for now. Really appreciate the demonstration there, and you've definitely sparked a bit of interest from the delegates as well. So really appreciate it, John.
Thank you for all the questions, guys.
Thank you. Right, everybody, up next, as mentioned, we've got Kerry Morgan involved, who is the Client Success Director over at E18 Innovation. We're going to be providing you a little bit of context from an ICS perspective. So if Kerry could join me, that'd be absolutely great. Slides are in nice and quickly. Can you hear me okay, Kerry?
Sorry, just doing a few clicks there. Yeah, can you hear me okay?
Loud and clear, loud and clear. We've got you, I can hear you, I can see you, and we've got your
Brilliant.
slides as well, Kerry. So
Brilliant.
smooth as silk. I'll see you
Fantastic.
after.
Brilliant, fabulous, thank you. I'll just pull my notes up. Good morning, everyone. As mentioned, I'm Kerry Morgan, Customer Success Director at E18 Innovation, and I'm going to take you through how the Intelligent Patient Portal can help within the context of an ICS. Next slide, please. So E18 have recently partnered with EBO, and the reasons for our partnership are EBO are part of an ecosystem of suppliers that help to deliver outcomes for the NHS. We've got a shared set of values and a shared dedication to use technology to improve patient outcomes and patient experience. And the Intelligent Patient Portal is a key digital transformation tool that we can offer to the NHS. Next slide, please. At E18, we work in partnership with 53 organisations across 17 integrated care systems, from acute trusts to community and mental health providers and primary care networks too. So we understand the importance of regional strategic alignment for the NHS, and as such, our approach revolves around building relationships with stakeholders at all levels of an ICS, driving collaboration and leveraging the power of integration to deliver transformational change. Our team's expertise, combined with our approach, allows us to facilitate the development of innovative solutions, promote evidence-based decision-making, foster seamless knowledge sharing and coordination between organisations, improve healthcare delivery, and transform patient outcomes. We understand that for the ICS, the biggest challenge isn't the technology, but it's the transformational piece to unlock the full potential of technology for the organisations and healthcare system. Next slide, please. So all of the ICSs are currently on an automation maturity journey. And when we look across the stages, I think most of the ICSs are probably in stages wave 1 and wave 2. So that's really starting to use automation technology to mainly improve efficiency, productivity, performance, and that's at an individual organisation level, and using the technology in silo. So technology like RPA, Power Apps, and those traditional patient portals. And where we want to get to is that wave 3, where we use all of the technology available to its full potential and transform system-wide processes to not only improve ways of working for staff, but also improve patient pathways across the system, whether that be from referral to treatment or with patients being cared for in the community services as well. So we want to get to a stage where information and interactions with patients are shared and updated in all of the systems used in each organisation across the ICS. And the Intelligent Patient Portal is a useful tool that will complement these other automation technologies and will really help progress the ICSs with their automation maturity journeys. Next slide, please. So there are a number of challenges that currently face our ICSs. The first one being conflicting priorities. There are a number of short-term competing priorities for the NHS. So things like obviously recovery, funding, bringing down waiting times, as well as ICSs trying to help the NHS achieve the long-term goals of providing people with the care they need in a local system in which they only have to tell their story once. And the Intelligent Patient Portal can be used to support the ICSs in achieving these goals. The ICS has different types of organisations caring for patients, and all of these have a variety of different systems that they use that simply just don't talk to each other. And this is really frustrating for patients because they then have to repeat information in all of the different organisations to the different healthcare workers caring for them at an already difficult time for the patient, for providing them with a really poor patient experience. And we can use the technology like the Intelligent Patient Portal to share and update information in the systems across the ICS, reducing that need for patients to keep repeating themselves when they're accessing the different organisations across the ICS, which will obviously improve their experience along their patient care pathway. There are over 110,000 vacancies across the NHS at the moment. We've got increased numbers of staff leaving, reduced numbers of people wanting to join the NHS. So how can we support the workforce with technology like the Intelligent Patient Portal? Well, it can be used to, as shown in the demonstrations, it can be used to manage a range of patient interactions, and this will increase staff capacity, taking pressure off already busy teams and releasing their time to care for patients. We all know that there's a limited amount of funding available in the NHS. However, there are currently some funding opportunities for organisations wishing to implement a patient portal or improve upon their existing portal. And there'll be further funding opportunities coming for our community and mental health trust too. So at E18, we can support any organisation with their bids and business cases to apply for these funding opportunities to implement the Intelligent Patient Portal. And if you'd like any support from E18, please get in touch via our website and we'll be happy to help you out. Culture. So this has really changed since COVID, with less staff worried about losing jobs to technology and more actually looking to use technology to support them with their workloads. Engagement is going to be really important with staff and patients if you're implementing this type of technology. We've got some patients who love to communicate via technology, they're used to it, they don't really like speaking to people. So these will really embrace interacting with the Intelligent Patient Portal. And then you might have others who are a little bit more hesitant and worried about sharing their personal information online via technology. So it's really important that we understand their concerns and bring them along with us on this journey so that they're comfortable using the technology in the knowledge that the data is held securely and it's safe to use. Next slide, please. So I've spoken about a number of ICS challenges, but now it's really important to understand the benefits that the Intelligent Patient Portal can bring to the ICS. Firstly, as mentioned in the previous talks, it's available to interact with 100% of the time. Obviously, it doesn't take a break, go to sleep. It's literally available 24/7. And this means that it will undertake the work whenever required by a patient. Patients don't have to wait for office opening hours for information, get the questions answered, and it gives patients really easy access to information and services, and they can do it at a time that suits them. It will fit in with their lifestyles. And this will really improve communication between patients and healthcare providers. The Intelligent Patient Portal continuously learns, adapts, and improves performance over time. This means it will obviously understand patient preferences, provide relevant information, and improve patient interactions, and will really enable patients to take an active role in their care and improve their experience along their care pathway. The AI algorithms can perform tasks accurately and consistently, reducing the risk of any human errors with data entry, and it can also interact with all systems. So this means that we'll really help manage patient data more effectively, improving the accuracy and completeness of patient records, and therefore the information available to healthcare professionals when providing care across the ICS. The ability of the Intelligent Patient Portal to interact with patients and deal with high volumes of queries will obviously take some pressure and reduce workload for staff, allowing them to do what they do best, which is supporting and caring for patients, which will obviously increase efficiency across the healthcare system. And the Intelligent Patient Portal will help make healthcare services more accessible to those patients who may have difficulty accessing care. Another key point obviously to mention, and as was mentioned before, is that the data is secure, encrypted, and collated on every task undertaken, allowing for full auditing to be carried out easily by any organisation needing to do this. Overall, this technology, used in conjunction with the other automation technologies, can help the ICSs operate more efficiently, improve patient experience and reduce costs, but it can also help deliver more personalised, patient-centred care, and will help the ICSs in tackling the short-term NHS goals that I've mentioned earlier, so supporting to improve recovery, funding, bringing down waiting times, as well as supporting the ICS with achieving the long-term NHS goals of providing people with the care they need in a local system in which they only have to tell their story once. Next slide, please. And if you'd like to speak to anybody at E18 about this technology, please get in touch with us via the website and we will arrange a follow-up meeting with you to explore it in a little bit more detail. Thank you.
Thank you, Kerry. Absolutely brilliant. Can you hear me okay?
Yes, I can, thank you.
Absolutely brilliant. We've just got time for one quick question, which is relevant to the presentation, so I thought I'd get it out now. So could this be embedded into an already existing ICS public portal, which is wider than just secondary care?
Yeah, so obviously I'm not the technical expert on the call, but yeah, absolutely. I know that the technology is interoperable and can work with a number of different systems, so that shouldn't be a problem.
Absolutely brilliant. Well, thank you very much, Kerry. Really appreciate that. And as mentioned, we will direct any further questions to you afterwards. So yeah, appreciate that.
Brilliant. Thank you.
Absolutely brilliant stuff. So next poll on screen, everybody, please do get involved. Do you feel that your own trust can be an innovator, particularly in terms of patient engagement approaches? So yes, please do get involved and be as open and honest as possible. That would be great. Give you guys 10 seconds on this one. Right, I think we'll wrap it up there for the poll. Thank you for everybody that's getting involved. Thank you all again for the amount of questions and interest that's coming through. Really do appreciate that. So without further ado, we're going to head over to Ron Burdis, who, as mentioned a little bit earlier on, is business consultant over at Access. And yeah, we're going to be talking about Rio Virtual Assistant, the inclusive solution. So Ron, can you hear me okay?
I can hear you. Thanks, Sean. Thank you very much.
No problem at all. Well, it's all good. We're ready to go. We've got you. We can hear you. I can see you. And I've got your slides as well, Ron. So over to you, sir.
Brilliant. Thank you very much. Hello, everybody. Thank you for your time spending today on this webinar. Very important webinar with you, with the Intelligent Patient Portal. My name is Ron Burdis. I'm with the Access Group. I'm one of their business consultants heading up the various AI programs that we have going on within the group itself. Click the next slide, Sean, please. The Access Group itself is one of the UK's largest business management solution providers. The annual turnover is around £700 million. They operate in the UK, Ireland, and Asia Pacific. Their focus is providing innovative solutions around business management in order to improve the client's businesses, as well as improving customer care and customer satisfaction within the organization itself as well. The organization is trusted by over 100,000 customers in 12 different industries, including private and public sectors. Next slide, Sloan. About 3 years ago, we entered into a strategic partnership with EBO. We saw that the EBO technology, particularly the conversation-based, was very unique, very pioneering in order to take in for a true digital experience for our clients. We focused in the healthcare area in the first instance with the solution itself, and had quite a lot of success with, as you see later on in the slides. The relationship is very robust, and we're very pleased with the results we had with the clients, and our clients are very pleased with it as well. We call the solution the Rio Virtual Assistant in terms of the healthcare sector itself. The EBO product is fully integrated within Rio. And we're taking advantage of the power of both solutions in order to provide a very slick engagement for both the patients and staff. Next slide, please. Access itself has a very aggressive AI program going on all across its industries. The EVO product has been kind of a crown jewel within the solution sets itself. We're with our experience we had with healthcare, we're now currently deploying it across local authorities and looking at the private sectors as well. Next slide, please. How we approached with the deployment within the solution itself, and we using the strength of the EVO platform in order to manage key areas such as conversation, communication, business rules, workflow, and integration into the solutions. And what that provides for us is a true good experience for our clients in terms of providing a true trust end-to-end process capability, being able to access data and update data within key business systems itself, applying trust rules and procedures in order to manage and automate as much as possible without getting human interface. Providing alerts and notifications where relevant, and again, following trust processes around there. Providing multi-channel communication and communication choice for the patients and the staff, and a full suite of reporting solutions within the solution as well. Next slide, please. As I mentioned, we see the strength of the system by tapping into the power of the business systems that it's interacting with. And we spent a lot of time with EVO developing the integration engines required to facilitate that, particularly with the Rio EPR platform, which you see here. But we also integrate the solution into things like the NHS app, third-party portals, looking at third-party suppliers of PAS and EPR systems, social care systems. Access itself has a very large presence in social care, GP systems, and other agencies throughout. But the beauty of this is that we can go out and with the patients, they can book and change appointments and update that information back into the EPR system itself, as well as collecting key assessment information, consent forms, questionnaires, proms and prems, et cetera, and being able to update that information into the EPR. So that way, for the staff and clinicians, they have a single source of data and trusted data within the EPR system itself, which is well secured. The next slide, please. Sorry, next slide. What I'd like to do now is review a little bit around the functionality of the solution itself. So the way I could describe it in simple terms is, with any use case, we kind of create a digital storyboard around that use case as it's applied for interacting with the patients and staff and following the trust procedures and processes and rules. So in the case of appointment, we can create a digital storyboard around how a patient would view that appointment, change the appointment, book a new one, book a follow-up, et cetera, all the way through, and have a digital dialogue between the patient and the virtual assistant to engage end-to-end and manage the process throughout to completion. Next slide, please. To give you a few examples in terms of some of the functionality we're deploying, within self-assessments itself, and John pointed out, we're doing consent processing around children's vaccination, which has been very successful with 3 of our sites. We're doing steroid injection consent forms as well. Self-referrals, the patient can self-referral. It can also be a collaborative referral format, as we're doing for Lincolnshire, where both patients and GPs, as well as the trust itself, is contributing to a referral form, and then that's uploaded and processed within the Rio platform itself. We do clinical assessments. I think John mentioned we have even very complex clinical assessment forms. We have one user to have 140 questions that we parcel out in parts, and we're able to spoon feed that to the patient and not overwhelm them with a 3 or 4 page form, but get them in sections and have that information fed up, consolidated and fed back into the Rio platform itself all the way through. We can send out wellness assessments on people who are on the waiting list to gauge their capability and see if they need to be prioritized back into service itself. And do things like proms and prems and friends and family assessments, discharge follow-ups, et cetera, all the way through. Under the appointment side, the system can allow for booking new appointments, viewing appointments, follow-ups, et cetera, canceling appointments, as well as having a verification management capability to reduce DNAs, so we can send out pre-configured text message ahead of the appointments for them to acknowledge and confirm, et cetera, all the way through. Next slide, please. And then within staff engagement as well, because the solution is just not for patients, but it's also for staff. The staff can engage with the system, for instance, for mobile workers for task management and and actually taking assessments in situ with the patients at home. Staff communication capability, the solution is fully integrated within MS Teams, so you can have a collaborative staff engagement capability using the system itself. Digital marketing campaigns, we can send out reminders about flu jabs, new services perhaps that the trust is rolling out, et cetera, all the way through. And obviously automating FAQs. So in the first instance, we deployed what we call the digital front door that provides a solution on the trust website that allows the patients, outside people, to come in and access through the virtual assistant information around the trust, et cetera, and address any kind of FAQs they might have. And those FAQs can also be addressed within the assessments we're putting out, as well as the appointments to help address them and support in terms of providing the services. Next slide, please. Access has what we call our integrated care platform, and we are working with various ICBs to provide an integrated care system from start to finish. We have a focus on the patient as a patient-centric concept with the patient itself, where we can provide as much automation as we can around the care pathway for the patient, from their original appointment within a healthcare setting through to discharge assessments, and including interfacing into the different entities such as local government, healthcare, and suppliers, et cetera, all the way through. Excuse me. Next slide, please. As an example, we can provide automation around discharge management, including for the clinicians to complete an assessment and requirements gathering around the discharge for the patient, where the patient needs to go next. We can provide all the provisioning around that patient for the next phase of their care pathway, such as medication, at-home needs, telehealth, et cetera, social care services, third-party supplier interface for services, et cetera. And then throughout the whole thing is what we have is a concept of visual ward management, both within the hospitals, as well as intermediate care, residential care, and domicile care. And what you see here is that the virtual assistant can be the communication and process management wrapper around all these key services and components to be able to move and migrate the patient from one care setting to another and make sure that we don't forget anything along the way. Next slide, please. So that was a pretty quick run through of what I wanted to present to you. I didn't want to bore you to death with the PowerPoint slides today. But as you can see here, we have 9 sites that are using the solution, and it's growing monthly within our organization. And as I mentioned, we're going to be rolling it out into other key areas within the Access group itself. Thank you very much. Any questions on that at all?
Thank you very much, Ron. Yes, we'll run through a quick question and then we'll just head into closing comments from Paul. So how much of the functionality will be available in the NHS app, and will there be ability to see appointments and letters alongside information from other trusts, Ron?
Yeah, so all the functionality will be available within the NHS app within the remit of the back-end business management systems throughout. So if it's a RIO site, all that functionality will be available through the NHS app, et cetera. And yes, they could have information coming back and forth through the whole thing. So we are working with NHS England now, as John pointed out, on the US side, with the single sign-on and the NHS app integration itself, and in terms of how we're going to view that and do that. We have a vision of what the virtual system will surface on the NHS app itself, so you can ask questions of the virtual system just like you saw in the demonstration, and get information fed back through that as well, and store that on the NHS app. So if you're looking at records, you can store that on the app as well.
Perfect, thank you, Ron. One quick last question here, which is a good one. So would you foresee this technology being able to guide potential participants for research studies through an engagement and consent to participate process?
Say that again, Sean, I'm sorry.
Would you foresee this technology being able to guide potential participants for research studies through an engagement and consent to participate process?
Oh, definitely, without a doubt. We can set up an assessment, consent form for that. Whatever they want to do is questionnaires, and have that patient being guided through the process all the way through, including disseminating information to them around certain questions, or the whole key program itself. We can definitely do that. I think what John was pointing out, this is a very configurable solution. And when we talk about use cases, there's hundreds of use cases you could do this for. It's not thousands. And it's not it's not software development. It's just sitting down with the client and working out their processes, seeing how they're doing it now. We actually even take in paper forms that they assessments and digitize those for the client itself. So it's just really gathering their domain knowledge and putting it into a digital format that's appetite for it for the patient.
Absolutely brilliant. Well, Ron, absolute pleasure to have you involved. Really appreciate the presentation, and we'll get those slides shared afterwards. So yeah, have a great afternoon. Cheers, Ron.
Thank you.
Thank you. Right, everybody, that brings us up to the end of the session. We've got another poll on your screen right now, and then we're going to hear from Paul Boland, who's going to close us off with some closing remarks. So, poll 3 on your screen right now. Which features of the Intelligent Patient Portal do you see offers the most value to your trust or healthcare organization? Please do get involved in this one, guys. We'll give you 10 seconds starting from now, and then we will welcome Paul back to the clinic. Absolutely perfect. Right, Paul, can you hear me okay? And if so, please do join me on the plenary.
Yep, I can hear you. Thank you.
Perfect. No problem, Paul. I can't see you just yet, but there we go. There we go. Beautiful. Right, over to you, Paul.
Okay, good. And you can see my screen, I presume, now as well.
Yep, perfectly.
Great, fantastic. So I suppose I'd just like to close by maybe summarizing. So hopefully this morning you've seen an intelligent patient portal that's designed with accessibility and usability at its core. And that's enabled by the introduction of automated conversation, or the power of conversational AI, into the patient communication. It's a portal designed for a new patient-centered health service where patients have much more choice and control over their own healthcare. And it's a solution that combines all the usual features of a traditional patient portal and the very latest in conversational AI. And what I'd just like to say on that point is, I know that many of the attendees here today will have already implemented digital solutions for patient engagement and patient communications. What I'd say to you is that we can help you to introduce the benefits of conversational AI in addition to those solutions that you've already got. So we can absolutely lay this solution and this technology over existing solutions, and we'd be delighted to have those conversations with you. As Ron's just said, it's a very flexible solution, and we're used to working in a consultative way with customers to do that. So that's absolutely a given. Alongside that, if you don't yet have a patient portal, or you're interested in supplementing other solutions you've got, then we can implement the full patient portal as well. So we think this is a step change in patient portal technology. We believe it gives you the opportunity to really supercharge your digital patient communications now. And obviously working in partnership with key partners like E18 and Access makes that even easier for customers of those partners. So if you're already working with E18 and you're already getting the benefits of automation from their Blue Prism solution and their expertise around RPA consultancy, you can speak to them, and we can work together to deliver patient-facing automation using EBO and leverage your investment in the E18 and Blue Prism solution that you've already got. We'd love to have those conversations with you. And equally, if you're an Access customer, then you can speak to Ron or any of the account managers at Access and talk to them about how we can leverage the full integration of the EBO solution in Rio, and leverage the existing contract and relationships that you've got with Access. Okay. I just wanted to touch then quickly on how we were going to fund this, right? Because money is always tight. And what I'd probably say to you is that we're used to operating with customers in a way where a bit like Carrie spoke about at E18, where we basically work with you to identify appropriate funding sources, and we can work with you to write up the business case and submit for that funding and try and work together to secure funding to move this forward. And just a couple of things to highlight. There has already been ring-fenced funding from NHSE for patient portals for acute trusts earlier this financial year, around kind of April, May time. And some of those trusts are still thinking about what the best way is of spending that money. And we'd love to have a conversation with you if you think there's a particular advantage in what you've seen today around that. We're also anticipating ring-fenced funding from NHSE at some point this financial year, hopefully, for community and mental health trusts specifically. Again, for patient portals. And when we get more details around that, we'll share it with the attendees on this webinar. But finally, what I would say to you is we're looking for early adopters to work with right across the health system. We recognize that AI, automation, and conversational AI are new-ish technologies. They're innovative, they're different. We recognize that you probably see the benefits, but you need help to start on that journey. And so we're looking for early adopters to work with who can help us to really fine-tune the solution that you've seen here today. And in return, we will offer financial incentives and additional support for those organizations who are, I suppose, willing to work with us as early adopters. Okay, so come to us, have a chat with us. We'd love to explore that with you. So yeah, finally, my contact details are on screen. All I'd say is thanks a million to our presenters and to Sean Convenzis for helping to organise. If you're interested in having a one-to-one conversation with us, my contact details are on screen. Please do get in touch. We'd love to set up a follow-up meeting with you where we can explore your local situation and give you some tailored advice. And yeah, get in touch.
Thank you very much, Paul. Just before we move, I'm just going to ask the delegates to answer one last poll, which is hitting the screen right now. To engage directly with the team from Evo and continue this conversation, please click from the options below. I'm expecting a really good response from this one because you've all been amazing with the questions and comments that have been coming through. So please do get involved in this final poll before we get things closed off. But just a huge thank you again from myself here at Convenzis, the team at Evo, and yeah, really appreciate you all spending some time with us today. Couple more seconds on this one, guys. Absolutely brilliant. Unless there's anything more from you, Paul, we can end it there.
I mean, the schedule finished, I think, was past. If there are one or two questions, we're happy to take them. If people, are interested.
Apologies, Paul.
So.
We have indeed got a few more questions. So sorry about that. So yeah, let's get going with this. So Gavin's asked us a question here. So I feel this would provide the patient with a seamless, flexible approach to engage with the trust, allowing for easy patient communication. Would Gavin's reflections be correct there, Paul?
Yeah, absolutely. I mean, as I think I've alluded to already this morning, this is about putting the human touch back into communications with patients. And we're on a journey, we're on a journey from the old ways of communicating with patients on paper and via the telephone to recognizing that those ways of interacting probably don't work for people in the modern world, and they're expensive, and we don't have enough staff in the system to work that way anymore. And we're trying to implement and move towards effective digital communications channels, but we all kind of know that's a journey and we're not there yet. And this is about saying, whilst the NHS is kind of maybe being reasonably slow to kind of adopt those technologies, the world's moved on. We've moved on in our day-to-day lives. We're already using automated chat. So let's try and bring that technology and harness the power of that technology for patients. And yeah, I think he's absolutely spot on. And we'd love to chat about specific kind of use cases with him if he's interested.
Definitely, sounds good. So let me just check the name on this one. I think it's an Ali. Hi, could I just ask about sustainability for primary care and GP practices, and if you have any GP PCNs engaged already? Or
yeah, sure. I mean, so in terms of sustainability, I mean, I guess, you know, if we can encourage patients to communicate with us via digital channels, then, you know, normally those are more sustainable methods of communication because we avoid travel and pollution, and we can reduce paper, and there's lots and lots of different kind of areas of that interaction where we can demonstrate improvements in terms of the green agenda and sustainability. Okay, now that doesn't just go for our solution, by the way. I think that would probably hold true for many digital solutions. In terms of PCNs, we've had loads and loads of interest from primary care and PCNs, and I would say maybe the slight challenge has been people laying their hands on funding, you know, and again, that's an area where, you know, the money's quite tight. But look, if there's a PCN out there that's interested in working with us, and if together we can identify a funding stream, let's bid for it and let's see if we can do something really innovative.
Love that. Thank you, Paul. Are there any examples of interoperability with System 1 in the pipelines, Paul?
So I think kind of John alluded to this earlier. So if you think about the way our solution works, it has a built-in integration layer, and that enables us to talk with any other system that's capable of being talked to, essentially. So technically, that requires APIs, or for it to be capable of communicating via HL7 or FHIR messaging, for example. So I suppose what I'm kind of saying is, in our solution, we have those technical capabilities. The question is whether the other system has them as well. Now, for System 1, an EMIS, an Epic, and all the other big EPR systems, there's definitely methods of integrating, and there's definitely established APIs. But it's a process that we just have to work through with you on a project by project basis. We've integrated with some EPR systems, not them all, but it's just a normal part of every project that we deliver. So I would say, don't be afraid about integration. Don't be scared off by it, because the benefits to the patient make this worth working through the pain of integration to make it happen. And we'll be there with you every step of the way.
Absolutely perfect. Someone's asked a question here about northeastern Yorkshire. Are you currently working in that area, Paul?
Ooh, northeastern Yorkshire. Yeah, I mean, I think you might have seen in the presentation that we're working with Lincolnshire partnership already. So yeah, they're probably the kind of closest to that neck of the woods. But we're a wide church. We'll work with any health provider across the country, in the northeast or anywhere else. Just come and have a chat to us. We probably just need to talk about the specifics about your local situation and what you have in mind and how you think we might be able to help.
Perfect. And from a patient adoption perspective, the kind of data states it's not uniformly strong. Does the intelligence portal offer any solutions for that at all?
Sorry, what did you say wasn't universally strong?
Patient adoption of portals.
Yes. Well, I mean, this is something that I think I've alluded to, and it is true that traditional patient portals do tend to plateau. I think maybe 15 or 20% of your patient population. And I suppose one of the key messages that we're trying to give you is, we're saying that by making your portal intelligent and more engaging using conversation, that we believe we can increase that adoption. And one of the things that we do is we make adoption a key kind of principle of our projects. And there's a number of different ways that we do that. It's partly about the solution being more accessible and more user-friendly, and conversation helps with that in any language, you know, being able to have a two-way conversation, answering patients' questions, all of that helps make it easier to use, right? But it's also about how we deliver the solution and making sure that benefits realization and driving uptake and adoption is a key work stream on the project from the get-go. And that's how we work. And it doesn't happen on day one, but what we do is we work with your teams, your comms teams, and your patient engagement teams to put a strategy in place to maximize patients' awareness of the solution and to make it as easy as possible for them to access it. So yeah, that's what it's about. Yeah.
Makes a lot of sense. Thank you very much, Paul. Peter just fired a quick question in here, but do you offer the technology to the private healthcare providers of this world?
We absolutely do. Yeah, we do indeed. And we work with a few private health providers today. Again, all the same benefits apply. We'd love to have a chat to you one-to-one following today's webinar, and let's see what we can do to help.
Absolutely brilliant. Well, Paul, amazing. Always a pleasure working with you and the team. Really interesting stuff. That's it for the questions for now, but we'll get them shared afterwards as well so you can further the conversation. And yeah, any final remarks?
No, just to thank you all for your time this morning. I hope you found it interesting, and maybe that you've learned something, and maybe you go away with a few little ideas about how we can together really supercharge patient engagement moving forward. So thanks a million.
Absolutely brilliant. Thank you, Paul. And just a final thank you for you all in attendance today. As mentioned, please do utilise the PDF that's in the handouts, and we will send over the slides afterwards and any further information you might need. So again, thanks again, Paul, and see you all soon.